Okay, so in this video we will do the push and infusion lock. So I have my MAR over here to look at. So, well, the 6 rights of medication, which are the right patient, right time, right dose, right drug, right route, and right documentation. And we'll practice hand hygiene, precautions that if needed throughout the procedure. And we'll check the MAR, so the patient needs the saline lock IV after 2nd liter of the normal saline, and give a pain medication every 2 hours. So that is what the IV push is. So we'll go into the patient's room, ask for the name and date of birth, wash the hands, and then we will assess the site for how it looks, like if there's redness or if it's any abnormalities. Okay, so then we will clamp all of the clamps on the tubing and clamp the one near the site. Okay, then we need an alcohol wipe. So we will remove this, wipe that. So this can be taken off. You want to flush about 5 mils of this normal saline, and then we need our
You're in video. Sorry, I didn't know.
our saline lock, and we want to teach the patient on how to maintain the lock and document how the patient reacted to this procedure. Okay, now we look at the order again to verify what medication in the patient. Okay, so then we need to, so we'll check the vial to make sure it's the right medication. So we will need to draw up 2 milligrams. And then we need to wipe off the top of the vial. Okay, and then we'll recap. Okay, and then we need to wipe off the port, flush another 5 milliliters of saline And then we remove the needle and throw that in the sharps. And we connect. Okay, so then you connect the thing and push the medication. It says 1 milligram every 2 minutes. So you just watch and push the medication. And then after you gave the medication, you just push another 5 milligrams of. So you push another 5 milliliters of the saline, and then we clean the port off again with alcohol. Okay, so then we need to assess the site. Even during the medication administration, you need to check how the patient's reacting, how the site's looking, like for any reaction. So we just check to see if it's still intact, if there's any redness. Okay, so then you discard all of the sharps, any of the equipment, and document how the patient reacted to the medication and the procedure. So we need to, now we're going to discontinue the IV after. It says discontinue IV infusion after the last dose of the medication, like piggyback. So now we need to prepare our equipment, and we need hand hygiene and put on gloves. And it says to loosen the tape. Okay, and then you discard. Okay, so then we will withdraw the catheter. And apply a pressure. And then you would put a gauze over with some tape for any excess bleeding and clean up the site. And then we would want to check the site again if there's any redness, swelling, any irritation. And then we will cover the site in a sterile dressing and discard all of the equipment that we used and document how the patient reacted to the removal of the IV.